Hello, I'm Tara Mosier, and I will be describing my nursing education project. The topic of my teaching project is delivery of oral care and the importance of adherence to an oral care protocol by critical care nurses to intubated and mechanically ventilated patients as an intervention to reduce ventilator-associated pneumonia, or VAP. As one of the most common hospital-acquired infections, VAP is a leading cause of mortality and death in the ICUs. Mechanically ventilated patients develop VAP within 48 hours of intubation, and it is caused by the translocation, usually by aspiration, of exogenous or endogenous bacteria into the normally sterile lower respiratory tract. In order to provide effective oral care, nurses must overcome a number of knowledge, patient, and system barriers. Evidence-based clinical practice guidelines to reduce VAP have been available for many years. There's an abundance of scientific and scholarly articles with supporting data that an adherence to an oral care protocol that includes chlorhexidine for intubated patients significantly reduces the risk of VAP. Unfortunately, these guidelines do not always bring about changes due to the inconsistency of nurses incorporating this evidence into their practice. An interesting point, according to Booker and others, is that chlorhexidine, which is recommended by the CDC for use in oral care, can be administered only by healthcare providers with statutory power to administer topical medications. In other words, a nurse cannot delegate procedures involving chlorhexidine to an assistant or aide who is not certified by the particular state to administer drugs. This emphasizes the importance of oral care as a nursing intervention. Discrepancies prevail in the delivery of care. Many nurses do not use the toothbrushes recommended and only use the toothettes. The use of the moisturizer may be omitted, as well as non-compliance with the scheduled times of oral care. And many nurses see oral care as merely a non-essential comfort measure that can be safely omitted rather than a fundamental aspect of infection control. Oftentimes, when nurses do deliver oral care, it is performed incorrectly based on outdated ideas and persistent habits rather than evidence. Knowledge is one of the most significant barriers to preventing VAP. Many nurses are unaware of the link between oral health and systemic infections. Patient barriers include, but are not limited to, restricted access to the oral cavity because of the endotracheal tube, fear of dislodging the endotracheal tube, uncooperative patients, or those with sensory or communication difficulties, or even an increased intracranial pressure. System barriers include a demanding workload, high patient acuity, time constraints, and insufficient staffing. A glance at this graph indicates that the compliance to a ventilator bundle that includes oral care with chlorhexidine significantly reduces the incidence of VAP. Other factors included in ventilator bundles in addition to oral care, but not discussed in this project, are elevation of the head of the bed 30 to 45 degrees, sedation vacation to assess readiness to extubate, peptic ulcer prophylaxis, DVT prophylaxis, and continuous subglottal suction. The learning objectives for this project will be, at the end of this presentation, the learner will be able to discuss the etiology and pathogenesis of VAP, discuss importance of oral care and the prevention of VAP, identify barriers to delivery of oral care, demonstrate appropriate step-by-step technique when performing routine antiseptic oral care, and follow recommended daily protocol for oral care with appropriate documentation. The learning goals of this project will be, within 2 months of presentation, the ICU staff will maintain delivery of oral care in accordance with guidelines. All ICU staff will be well informed of the risks of non-adherence to an oral care protocol for intubated patients. Established standing orders and documentation protocol will be in place for oral care, and unit VAP rates will decrease. Teaching strategies to implement this project will include a tabletop in-service, which could be designed and placed in a standing document holder and placed in various locations within the critical care unit. Information included in the document would be facts about VAP, prevention measures, standardized orders, documentation how-tos, and a step-by-step guide to oral care with rationale for each step. It would be beneficial to provide photographs of available oral care kits if possible. A PowerPoint presentation could also be developed and include similar information as in the tabletop in-service document, but with more detail to national initiatives, statistics, documentation and data collection, and evaluation of the intervention. The oral care presentation PowerPoint could also be delivered in staff meetings, annual skills checkoffs, and be included in the ICU orientation for new employees. Posters similar to these could be hung in visible areas such as near hand washing stations, the nurses' lounge, or a bathroom bulletin board. Some states currently require continuing education units or hours to maintain licensure. And according to the Georgia Board of Nursing, effective January 31st, 2016, all registered nurses will be required to complete continuing education competency requirements as a condition of licensure renewal. In this case, offering a free continuing education hour credit could be an incentive for nurses to receive mandatory teaching on this topic. Providing nurses with references and education needed in the care and management of mechanically ventilated patients as it relates to oral care is essential to any hospital's mission to deliver quality health care. The CDC recommends that the healthcare institutions educate nurses and other qualified healthcare staff on preventing hospital-acquired pneumonia. Educational programs should include the importance of oral care and infection control, recommended oral care products and practices, institutional policies, and institutional VAP rates. In order to evaluate the effectiveness of the recommended education, a surveillance team should be created to monitor compliance to oral care protocol, compliance to documentation, and trends of VAP in the unit. Post-test after the in-service or online module should be completed and used as an evaluation tool, as well as a skills checkoff list. This concludes my presentation. Thank you.